Welcome, everyone. It's great to have you here for this info session on the GPHAP program. I am Laura Botwinick, the director of the program, and it is the graduate program in health administration and policy, and we call it GPHAP, the GPHAP, and the PH is net of the sound. The program has been around since 1934 here at the University of Chicago, and it's known as the first health administration program in the country. It started at the business school, and so a lot of the oldest alumni of the program are executives in the healthcare field. But in the early 1990s, it was transferred over to what was then called the School of Social Service Administration. That's what Crown Family School's name was before the Crown family gave a big donation and got the naming rights. So it's the Crown Family School now, and that's where GPHAP is housed. I am a healthcare expert. My background is in quality and safety of healthcare and health system change, health system improvement, process improvement, change management, and health policy and reducing health disparities. That's what I have experience in, and I can bring those things to all of you within GPHAP. Before coming to the University of Chicago, I worked at an organization called the Joint Commission on Accreditation of Healthcare Organizations, and that was an accrediting body. They also wrote standards for quality of care in hospitals, also behavioral health, / mental health care organizations, ambulatory care, long-term care, and others, hospice, home care, and so forth. And they also have international accreditation. And so they accredit international hospitals as well. And that began my start also on learning more about global health. And as you'll hear in this session, we have a US focused track and a global health track. I also have experience working with the Institute for Healthcare Improvement, which is an innovative healthcare change process improvement organization based in Boston, and it's a great organization as well. I served a year as a fellow there and stay connected as an IHI fellow, and so I bring a lot of info from the IHI to the GPHAP students also. I also am an adjunct instructor at University of Chicago, and I teach the capstone class for GPHAP, which I will tell you more about. So that's me, and now I'll tell you about GPHAP. So I'm so glad that you all came, want to learn about it. It's this really special certificate program at the University of Chicago. It serves students at the Crown Family School, but also policy students, business, law, medicine, and sometimes even the divinity students. So students from all those schools who are interested in healthcare can apply for the GPHAP certificate, so they can get their master's degree, like their management, their public policy degree, or their medical degree, or their law degree, and get this GPHAP certificate. So they get the healthcare content, and they get the experience working with you and the other students. So they get the experience in interdisciplinary teamwork and understanding the other disciplines, and that's what they can say. That's what you guys can say that you leave with. You're getting your training here at Crown Family School with this additional expertise in healthcare. Even though it's called healthcare administration and policy, it can really be tweaked and tailored to your interests. And I really want to get that message across to you, because sometimes people are shy away from the name, but healthcare delivery, health and wellness delivery today encompasses so much more than what just happens within inside the walls of a hospital or a clinic. And there's something called, which you may have heard of, the social determinants of health, sometimes called the social determinants of health. And those relate to housing, food security, even wealth equity, and more even climate change is becoming an issue related to health. I mean, it is right now. I mean, we definitely have people thinking about it and courses in development around climate change and health. So I offer that to you, as well as to say that within GFAP, you can also focus on specific segments of the population and their health and wellness. So if you're interested in LGBTQ health, or you're interested specifically in health equity and reducing health disparities, or women's reproductive rights, or anything like that, can fit within GFAP. And I'll explain how as this unfolds. If you're interested in criminal justice, that can work too. I mean, we have had students who have been interested in the criminal injustice system, and there are issues around healthcare within that system, and with transitioning into healthcare when they are coming out. And so there's just a lot of stuff. If you're interested in maternal, child health, you can do it within GFAP. The program has three buckets, and that's how I describe it. It's got the coursework, it's got the practicum, and then what we call the co-curriculars. The courses involve 2 required courses and 2 health electives. And those courses all count toward your master's degree, and there's no extra charge for participating in GFAP. We have the 2 tracks. So on the US track, the first required course is a great course on the US health system. It's called US Health System and Politics, and it's taught by Professor Colleen Grogan, who I mentioned previously, and she's an expert in Medicare and Medicaid, and is just a really great person to know and to work with and to learn from. So you take that course in the spring quarter of your first year. And then the second required class is in the spring quarter of your second year. And that is what we call the capstone class. It's technically called Key Issues in Healthcare, a case-based interdisciplinary approach. And that is the one that I teach. And what we do is we line up real cases in the healthcare field and put together interdisciplinary teams. So you would be on a team with one student from each of those other schools I mentioned, and you work together to solve a complex problem given to us by the mentor or executive sponsor of that issue. So we have cases from federally qualified health centers, or cases related to an entity on the south side of Chicago that's connected to University of Chicago Medicine, that is trying to serve the whole South Side in an innovative way. We've had an insurance company that has Medicaid programs in 21 states, and they are working on innovative things actually around how insurers can pay for housing and food and things related to returning citizens from the justice system. And so we get some really great cases from them as well. And we have had issues around the financialization of healthcare, just whatever's hot. I keep my eye on all throughout the year and have a long list of great cases. And then I learn about you and your interests. And sometimes I can even find and have cases that I know would interest some of the students. You aren't necessarily guaranteed to get those cases. I mean, what we get to do in that class is that you get to prioritize the cases that are of interest to you, and then I put together the teams based on your priority ranking and the ability to put together interdisciplinary teams. That course, it has a focus on interdisciplinary teamwork and solving the problem for all. So there's an element of health equity and attending to that in every single case. So you get some experience in operationalizing anti-racism in healthcare and looking at disparities by race, ethnicity, language, and other dimensions, and solving for that. So You work on the one case for the whole 9 weeks of the quarter, but we also have conversations together, and you get to learn about all the other cases as well and see them in progress. So that's the capstone class. And then you get to choose your 2 health electives, and this is a way that you can really tailor GFAP to your interests, because you get to choose those 2 other courses, you know, in alignment with your interests. We put together a list of approved health electives, but if you see a course here at University of Chicago that interests you, you can run it by me, and it might be able to count. Those electives are times when you can go outside of Crown and take courses, which is a neat experience. I mean, you're encouraged to do that, but you don't have to do that. So that's the courses, and I mentioned that we have a global health track. The only difference is that the first required course is a course on, it's an intro course. Now, it has been a course called Global and Social Development, taught by a professor who's going to be on sabbatical this coming year. So what we're going to say, that course is not going to be offered in the spring of this year. So what we're going to say is that students who are on the global health track would choose essentially like a third elective. You would get to choose a global health course that could substitute for that first one. For global health students, your 2 health electives can relate to US health, because you can see what's working right and not working right here in the US and apply that to a global health setting. And same for people on the US track, your 2 health electives, or one of them, can relate to global health, because students are interested in healthcare worldwide. And you can learn what's going well and not going well in other countries as well. Our global health track relates to vulnerable populations, so we're focusing on low and middle income countries in our global health track. So that's the courses. And then we have the practicum. And the practicum is it can be a summer internship. It can be research assistantships that we offer, or in many cases, it can be your field placement. So for Crown Family students, depending on what your field placement is, it very likely could be the GFAP practicum. So you can count it as both. And then finally, there's the co-curriculars, and that's going to healthcare lectures throughout the year. And we target 3 per quarter if you're a full-time student. So that's a total of 18 co-curriculars. Also, so this is like going to lunchtime lectures from lecture series that happen, and we get the word out about those, and so it's real easy to find them. And you can even get your co-curriculars if you're listening to online recordings of the lectures, or participating. If it's a hybrid event, you could Zoom in and it can still count. And then students write up a 250-word reflection on that. Doesn't have to be a comprehensive summary. We don't want people to stress over it. You can even write it while you're listening. But it's a way really to reflect on what you're learning and what you're hearing, and how it connects with other things you know and have learned, and also to reflect on questions you may have, what you think about it. You're starting to form opinions about things. You can write about that also, what you want to know more about. We also count for co-curriculars the occasional GFAP social networking events. So we'll have a pub night in the fall and winter quarters. We'll have a more fancy event in the spring quarters. We'll have a alumni student event, which is one of those cocktail receptions in the spring quarter. And we have just a great alumni now. So we also have what we call the alumni mentorship program. And I give all the GFAP students an opportunity to have some phone calls with GFAP alumni who are agreeing to participate as mentors. And you can just learn more about their career paths and and talk to them about GPHAP and how to make the most out of their time in the program and their time in at UChicago. So that's the co-curriculars and the practicum and the courses. And I'll add, and then, well, I can ask, I'll stop for a second. Do you guys have any questions about the things I've said so far? Okay, you'll have a chance to ask later too. Our GPHAP program is funded on endowments. So we have the benefit of having the funding, and some funds get peeled off each year to support the program. And we're able to pay stipends for the internships that we have at GPHAP. And what we do each year is I line up 11 or 12 research assistantships. They don't have to relate to hardcore research. Some of them are internships at the medical center. Most of them do involve some amount of research. But we offer those. I list them in the fall quarter, and you pick them, and they are just 100 hours. They are often served over 10 weeks, 10 hours a week. And that counts as your GPHAP practicum. There'll be a chance for you to express interest in them. Then I send your resumes to the hiring managers, and then they do interviews and they select the person to be in that role. They're not jobs, but they're learning experiences. And so the mentors know, the hiring managers know that that's not supposed to be busy work. It's supposed to be a learning experience for you. The other types of internships that we have are what we call the summer internships. And there's two types. One is the Erickson Summer Fellowship, and one is the Quern, Quern, Quern Fellowship. And the Erickson Fellowships are internships at the medical center during the summer, 10 weeks full-time, 5 days a week. And the stipend for that, I'll tell you what it is for the RA ships. The stipend for the Erickson Fellowships and the Quern is $7,600, and it's based on 400 hours. And the stipend for the research assistantships are $1,800 for first year GPHAP students and $1,900 for second year, because you have more experience in your second year. The Quern Fellowships are innovative projects of your own design and working with a faculty member or some other mentor to give you guidance on that. And so the Quern Fellowship, I said, is also $7,600 based on that same level of effort, 10 weeks full time. And those are meant to be not, filling an internship role that somebody else has created for you, but something that you would like to do and learn about. And the process, the application process for that is first a letter of intent, because we have 5 of those only. We budgeted for 5 Querns, and then we choose 5 people to move forward and do a more detailed application in which you would kind of be more specific about what you're going to do in each of the 10 weeks, so that you have that kind of structure to the summer. Thinking. We have one more fellowship, and that's the Brown Fellowship. That's one that we offer to one student from each program as you come into GPHAP. It's something that you apply for as part of your application to GPHAP, and that is a person who works with the Brown Fellows from the other schools in your cohort to plan 3 events for the GPHAP community, which could be panels or a speaker or something else. And that's just a neat opportunity to have a little more interdisciplinary engagement with others who wanted to be Brown Fellows. And you're also the person I would go to first just to ask about how things are going from, from your perspective. And if we're planning an event, does this particular day, do you think it'll work for other Crown students? Those kinds of things. If people want to talk to a current GPHAP student, I would email you first to see if you'd be willing to talk to them. So that's the Brown Fellowship, and that comes with a $1,000 stipend. And the events that you would plan would be one in the spring quarter of your first year, and then one in your fall quarter of your second year, and winter quarter of your second year. We have a weekly digest that we produce, so that goes out once a week, and in it has the lectures and events that are coming up in the that can count as co-curriculars. We sometimes have student spotlights, occasionally alumni spotlights. Put information in there that you might need to know about GPHAP. And if you want to see those, we actually archive them on our website, and you can look at past issues. We are guided by a board of an advisory board that has representatives from all the schools. And that's pretty much it. If you're interested in global health, there's a GPHAP certificate. It's the GPHAP scholars at Crown, and that is compatible with the GPHAP Global Health track if you are on the parallel track of the GPHAP Scholars Program. If you are selected to be on the immersive track, they call it, you have to be away when we have some of our required courses. So only the parallel track works. All right. I'm going to ask again if there are any questions. I know. Okay, good.
Oh, yes. I was just wondering, with so there was like the Erickson Fellowship and the Brown, like, can all of these overlap, or are you only allowed like one fellowship or one type? Like, can you stack multiple things that give you stipends, or is it only, one thing per quarter or per year or something like that?
Good question. We say if you have an RA-ship, that 100-hour thing in your first year, you are eligible to apply for an Erickson or Quern. We say only one Erickson or Quern because if you're a full-time student, you will have graduated, so it doesn't matter. But if you're a part-time student, we still just issue one so that we can spread out the funds in our endowment. If we say if you have an Erickson Fellowship, and at the medical center, say, sometimes students want to get an RA-ship in that same spot the next year. And we ask that students not do that. We want to be funding you in getting different experiences. I do say when we issue the RA-ships, we say that first year students get first dibs, and people who have not had an RA-ship. And so then after a period of time, if they're not all taken, because we do only have a budget for 11 or 12, then we can put it out to people who have had one before. But they often go in that first round. So that's how that goes. And if you are the Brown Fellow, you absolutely can have any of those fellowships. One thing I sometimes say, sometimes people ask is, how many do we choose from each school? And I will say that within, that we use on the US track, we bring in about 10 from Crown, 10 from Harris, 10 from Booth. So that's the Harris School of Public Policy and the Booth School of Business. And then on the US track, that is. And then on the global health track, we bring in 3 or 4 from each of those schools. And then the law school, we're really happy to have law students because they're an amazing part of the interdisciplinary team, but they don't seem to sign up as much for GPHAP. Their programs are just geared toward getting internships law firms where they'll, get offers, but though there sometimes are amazing law students who want to focus in different elements of healthcare. Like right now, we have one who's really interested in disability care and law. And there have been law students interested in health laws as relates to LGBTQ folk. And so those that do apply are super interesting and great to work with. And so we always hope to have 3 or 4. One year recently we had 6. Last year we only got 1. So fewer law students. And then the way it works with the Pritzker School of Medicine students is they participate during all 4 years of medical school. So, and we are bringing in 4 or 5 medical students on the US track and 4 or 5 on the global health track.
Laura, we have a question in the chat.
Sure.
For the Brown Fellowship, is the stipend meant to be used for planning the events?
No, that's a stipend for you. We have additional budget for food, or we don't have a big budget. Like we're not flying in speakers and giving honorarium, but we purchase food if it's a lunchtime event for all the attendees, that kind of thing.
Thanks, Laura.
Hi there. I have a question. What do you look for the students when they're applying through their applications?
Yeah. Sometimes people feel like they have to know that they are interested in healthcare or, social work and healthcare. You do not need to know that's what you want to go into. We're not looking for somebody with lots of healthcare experience. You're going to learn about it in the intro class and get exposure, and you can, learn about your other interests and dive into other interests at the same time that you're taking GPHAP. So what I do tell people is if we happen to have so many applicants that we have to start turning people away and making choices, we will then begin looking at people's healthcare experience as an expression of them being, really being interested in pursuing this program, because we don't want people dropping out once they're in, when we've turned away other people's, and we don't want people dropping out once they're in at all anyway. So if you're having any issues or concerns once you've joined, please reach out and we can see what's going on and see if we can make it work for you. But what we're, the application it's a very short essay. It's a 2 or 3 page essay to a single question about you and your background and interest in participating in GPHAP. And so you can tell your story and say what aspect of GPHAP you're interested in and why you want to participate in the program. Does that help, or do you have more specific?
That helps. It's just because I work in an ABA company, I was I don't know if my supervisor could write you in, because it's a different field, but
What
really,
did you say?
ABA behavior. It's working with autistic kids spectrum.
Oh,
Yeah.
sure. That
So-
absolutely counts as healthcare.
Alrighty.
Yeah. When we talk about healthcare, we're talking about mental and physical healthcare. Okay. So we're talking about you're here at the School of Social Work, Policy and Practice. And so this program is about administration also of behavioral healthcare. And so right now, and for the past many years, there's been trends in integrating behavioral and physical health, and a lot of programs in mainstream hospitals and health systems are designing programs for integrating behavioral health with mental health care. Behavioral health with physical health care. So administration and policy around all that is GPHAP.
Oh, okay, that sounds good. Thank you for clarifying that, because I wasn't really sure. So
Yeah.
thank you so much.
That's a great question. I guess the reason why we should keep the recording on so others would get to hear that. That's important. Anything else? Okay, well, you can find the application form on the GFAP website under admissions. And I know that when the folks send out the recording and I've got a 4-page kind of typed up version of what I have described to you so that you can see, you have that and you can reflect on it. And they'll send the link to the admissions form. So the due date is the day after Labor Day, which this year is September 3rd. And we will look at all the applications at that time. But if you have any questions or want to follow up with me, I'd be happy to answer your questions by email or have a phone call.
I'm sorry, I thought there was
Sure.
maybe more information and then another chance to ask questions, so I didn't realize this was the last chance. But one thing I was curious about, I had been thinking about, the dual degree programs that might be offered, and I learned that Booth has, within their Masters of Business Administration, they have a healthcare concentration. And so that was something I had thought about with my interest in healthcare. And so when I heard about this, it seemed like a really great blend of those things. Would you say that it's sort of a more succinct version of that, or are there major differences, that would mean I should still consider the other pathway? I'm just kind of curious on how they would be similar and different.
That Booth healthcare concentration is, it must be really new because I'm not sure I knew that they had that. But if you can correct me, but I think they probably they have a few healthcare courses that you can take as your GFAP health electives.
Okay.
And Booth has always had these kind of strategic, I forget the exact term for them, but like, that people can kind of focus in marketing or budgeting or strategic planning. And I have a feeling that their healthcare concentration is probably like those. But I'm going to look it up to be sure. So you can, if you're thinking about being a dual degree student, and so getting your MBA along with your Crown degree, you might want to take that healthcare concentration, and you could get the GFAP certificate because I would count those courses as GFAP health electives. But if you don't want to get the MBA, then you could still take courses at Booth as a Crown student. You don't even have to be a GFAP student.
Okay.
And I will say there are occasionally courses at Booth that are for Booth students only. I think they, I've seen that. Ron, do you know? I know the courses that I list as GFAP health electives are not ever Booth students only.
Yeah, I'm not quite sure if there are Booth exclusive classes, but we definitely know that our students take Booth classes. Yeah.
Yeah. I mean, that's one of the features of coming to the University of Chicago is that students can take courses at all the schools.
Right. Okay. Thank you. I was just curious about that. And then I'm also a little curious about, does GFAP become your academic pathway? So, for a degree at Crown, I don't know if everyone here is going to be going to Crown or some of the other graduate schools, but since you kind of have that academic pathway as you complete the degree, does that mean that GFAP is the pathway, or do you have a pathway in addition and this program is kind of a subset?
Ron, do students have to choose a pathway?
Yeah, so the students will select a pathway, but the certificate would be in addition to that. So the certificate the pathways are really broad-based, and so the certificate should fit into, there's not one specific pathway that a student would select. So you'll have your pathway, whether it's the global focus one, or the child and family systems, or the health and mental health pathway. So the GPHAP could fit into any of those, and then so that it would be kind of a +1, and then the electives that you're taking would count towards the GPHAP certificate.
Okay, that makes sense. Thank you.
So I'll sum up with saying that if you're participating in GPHAP, you're opting into this really great interdisciplinary program that gives you a chance to step outside of the walls of your home institution. And some students just really enjoy having that. And it's fine if students don't want to do that, but being in GPHAP gives you that chance to hear about the frameworks and approaches that the other disciplines bring to solving a lot of the same problems that you're working on from your perspective and with the expertise that you're gaining at Crown. And there's also a specific emphasis in our program, and you'll see it definitely at Crown and in some of your other courses, perhaps, on health equity and reducing health disparities and understanding those issues. So you'll find that there. And then when you get your GPHAP certificate, you'll be an alumni of GPHAP and join the alumni of GPHAP as part of that larger community.
Laura, do you have time for one more question? I don't know if you're...
Absolutely, for sure.
Okay, yeah. Will, go ahead.
Sorry, I know you're wrapping up.
No, that's fine.
I know earlier you said that the person who was teaching one of the first year required courses is on sabbatical right now. And so you were saying, just to clarify, you're saying that means that we have 3 free electives that we can take?
That's for the global health track students.
Only for the global health track, okay.
We'll bring in, four-ish global health track. That's only for the global health track. The US track students will take Colleen Grogan's US health system and policy.
Okay. And so then for the other 2, it can be any class within Crown or the other affiliated graduate schools?
It would be a class from our list of approved health electives.
Okay, so like a therapeutic modality class that's not listed in that, that's not in that list wouldn't count then?
That sounds like it's a clinical class, and so that's not what we do. But if you see a course that you think should count and it's not on my list, you could just email me and say, could this count? And then I'll ask you to send me the syllabus and we'll take a look. Sometime a course that's not on the list might ask for a final paper that's worth 50% of the grade. And if you're writing on how that topic applies in the healthcare field, then it could potentially count as a GPHAP health elective if it has health content of 50% or more.
Thank you.
Yeah. So I hope you'll all consider it. You all sound great, and we would love to see your applications in the fall.
Great. Thanks, Laura. I'm going to turn off the recording now.
We were recording. Good. Then they got those answers.
Yes. Yep. So still recording. So thank you everyone for participating. And thank you for the audience for listening in. Oops.